Hello, everyone, and welcome to this Gemba 360 special legal compliance session on the new laws around the COVID-19 requirements that agencies need to be aware of. My name is Nihal Samar. I'm the General Counsel and Legal Director of the law firm Kaizen Synergy, and I'd like to welcome you to today's session. These sessions are being recorded all the way up to the question and answer part of the webinar, where we do open up the computer lines and phone lines to answer any questions that people might have. And we are openly making these available on the Gemba 360 e-learning space, and also, as requested by a number of community service organisations, also publishing these across the YouTube channel and resources being circulated around to attendees as well too. So I'd like to welcome you all to today's session. Today's session is going to really focus specifically on some of the new rules and regulations commencing, some of which have commenced in the last few days, some of which are commencing this week as well too. So we are going to give you an overview of some of the specific requirements you need to be aware about. As always, we'd like to pay our respects to the elders past and present upon the land on which we all meet. While this session is being run by webinar and recorded, we do pay our respects to the traditional owners from where you all join us today. So with it, there are a number of specific items we are going to be covering off directly in today's session. One is around the update on wearing face coverings and the extended state of emergency, a brief overview of the rules for border towns, particularly in the New South Wales Victoria border line. We're going to look at the rules for outside metropolitan Melbourne and the Mitchell Shire. Also specifically looking at the extension of the state of emergency, as well as return to stay-at-home restrictions, which have already occurred for some areas, and also just referencing COVID safe plans and also special service areas in the space of aged care. So with it, the extension of the state of emergency in Victoria has been extended and will be in place until 11:59 on Sunday, the 16th of August, and that has been published by the Victorian Chief Medical Officer. In saying that, what we need to put this legal compliance rules into context on is around the second wave, clearly, that we are now seeing. I have pulled this information directly from the department's website, and it puts it into context around where we are traveling and what the requirements are. And I'll come to that from also a staffing point for each of your agencies, and also the importance of reporting on the daily COVID forms, especially if you are in the health and well-being space, and also if you do provide services to vulnerable populations like Aboriginal and Torres Strait Islander agencies, many of which we have joining us today. Now, in context around this as well too, when we look at cases by local government area, we can see the spread of what the current confirmed cases are. For example, in the Shepparton area, just as an example, we are seeing 17 cases by local government area. And this then escalates into areas like Hume, for example, where we've seen 593. That said, if we look at the current active cases by local government area as well too, and this information was taken from, as you can see, the Department of Health and Human Services site. Then again, in the Shepparton area, as an example, we're seeing 2 active cases in the Greater Shepparton area, and also in the Hume area. What we are seeing is a couple of hundred odd current active cases. Now, putting that into context around some of the rules and regulations, the spread of the COVID-19 and the issues that we are having is because effectively the spread can travel so very, very quickly. So as part of that, what the Chief Medical Officer's direction is as of 11:59 on Wednesday, the 22nd of July, is that if you live in the metropolitan Melbourne or Mitchell Shire, you must wear a face covering when you leave home. And this effectively takes place, as I mentioned, from 11:59 on Wednesday, the 22nd of July. In some contexts, though, as well too, such as medical and aged care services, agencies are all already expected to maintain PPE adherence, compliance to PPE requirements as well. So while this is just generally for the general population, that we are looking at from 11:59 on Wednesday, the 22nd of July, if you are in these particular areas as well too. Now, there are a number of reasons if within Melbourne and Mitchell Shire not to wear a face covering, and these include obviously for medical reasons, if you're under the age of 12, for professional reasons, and if it's not practical, for example, for running. That said, there are fines that will be imposed if you do not comply, or your agency also does not comply with these requirements. In special service areas like aged care, there is an updated document from the 1st of July from, again, the Department of Health and Human Services. And this document, while being focused on aged care, also applies to disability and other service providers. And there are a number of checklists included within and referenced within this document. And already we have updated these and made them available if you need them on your Gemba 360 dashboard. If you do need to access these, then just let us know and we can get these switched on for you. And it provides you with the checklist tools that you need in terms of screening either a suspected case, confirmed case in a resident, confirmed case in a staff member, case in a visitor, or out of an outbreak in a facility. So again, there are clear guidelines and rules that need to be followed in this space as well. In relation to border rules, which is also causing a bit of anxiety across areas, is that new restrictions will be stricter from midnight on Tuesday today, the 21st of July. Effectively, all currently issued permits and any issued between now and on the commencement of the border zone midnight from tonight will mean that people will need to reapply for new permits. Now, there are a number of specific and restricted rules for actually getting a permit. These are that either you need to go to work or attend an education institution if it can't be done from home, or to obtain medical supplies or health services. And effectively, border zone residents with a permit will only be able to cross into the other side of either New South Wales or Victoria to do those handful of things. So it is important, especially if you are in the northern part of Victoria or residing across the border, like some of you are that are joining us today, to be aware of what these new rules are. Now, again, the rules on leaving home, and this applies across the state at the moment, is that there is 4 rules. 1 is for shopping for food and supplies, 2 for care and caregiving, 3 for exercise and outdoor recreation, and 4 for study and work, again, if you can't do it from home. Now, what is important around this is that penalties for non-compliance are significant, and these have been continued, and we have seen these in the past. What I'm going to focus specifically on is that fines of up to $20,000 for individuals and $100,000 for businesses are possible through the court system. And we have had reports that this is now being followed through. So specifically for community service agencies, it's important that the agency and yourselves in roles of compliance or quality or executive managers are aware of what these extended fines are, because it looks like, and I'll say this, it looks like the government are taking it a bit more seriously through the use of police and enforcement measures. In addition to that, the fine for not wearing or carrying a face mask will be $200 as well too. And this is also a new enforcement measure that is being imposed effectively from 11:59 on Wednesday, the 22nd of July this week. Now, if you live in metropolitan Melbourne or Mitchell Shire and need to travel outside these areas, your face covering will need to remain on for the entire time that you are there. If you live outside metropolitan Melbourne and Mitchell Shire, you'll need to wear a face covering if you visit metropolitan Melbourne or the Mitchell Shire. So it is working in reverse. It also means that there is recommendation that you wear one in your local area if you can't keep 1.5 meters distance from other people. So it is something, the use of face masks clearly is something that is being adopted indirectly statewide, and it is something that you'll need to be aware of. Now, what we are also suggesting is that agencies go back through their COVID plan checklists as well too, and ensure that staff are across these particular areas that I've actually covered off today. It should be that policies, procedures, and I've just highlighted some of these again, and these are used from our previous sessions as well too, that effectively these just over half a dozen items, and it goes on to the next slide as well too, is in fact updated by your agency. Effectively, we are going back to ensuring that there is discouraging of carpooling between employees to and from work, also promoting good hygiene and providing hand washing facilities. And this is effectively covered off in your COVID safe plan documents as well too. Again, the policy of ensuring that staff stay at home if unwell, and this is consistent across all of the previous webinars that we have been running. What is equally important for agencies is utilizing the daily COVID-19 assessment form. We have had reports that some staff are also running their own, I'll call it, compliance program for other staff. If you do or are aware that other staff are not completing their daily COVID assessment form and coming into work, then it is something that you need to follow up with your line manager. There are very clearly work health and safety obligations that all staff need to know and follow. And if it is a policy within agencies to maintain that all staff maintain their daily COVID assessment before commencing work and documenting and reporting it down, they're not doing that is effectively an work health and safety issue. So with it effectively following these 14 key points and ensuring that staff communications are made on these new rules across your agency is something that we are recommending that all agencies in fact do. And that will ensure that you meet your COVID safe plan, your policies, and also updated of your pandemic forms. So these are the take-home message that we have sent through. We will be circulating out these slides and documents to yourselves as well to ensure that you are kept up to date. If you do have any questions, we will open up the phone lines shortly. But if there are any questions that come out of today's session, by all means, please contact us on 1300 360 360 or email us at support@gemba360.com.